Anatomy, musculoskeletal system. In this video, we're going to discuss the muscles of the head. We're going to talk about the intrinsic muscles of the head, which are those that originate and insert at the level of the skull. There are two types of intrinsic muscles of the skull, the mimic muscles and the masticatory muscles. The mimic muscles generate facial expressions, a useful function for communication. In contrast, the masticatory muscles move the jaw so the chewing movements take place. Let's now analyze the mimic muscles in more detail. We can divide them into a few groups: the epicranial muscle, the muscles of the eyelids, the muscles of the nose, and the muscles of the lip. The epicranial muscle is this large muscle that covers the entire upper surface of the cranial cavity. This muscle consists of two parts, which are its muscle bellies, the frontal and occipital, plus a large epicranial aponeurosis. It is actually not one, but two equal and symmetrical muscles. The frontal muscle is even, symmetrical, and inserts on the skin of the eyebrow region. By contracting, it wrinkles the forehead. The occipital muscle is also even and symmetrical and is inserted on two lateral thirds of the superior nuchal line. Finally, the epicranial aponeurosis consists of two large quadrilateral laminae, one for each epicranial muscle. Its superficial face is closely connected to the dermis, while the teeth face is in contrast with periosteum of the cranial bones. Let's now move on to describe the muscles of the eyelid. It consists primarily of two muscles, the orbicularis of the eyelid and the corrugator of the eyebrow. The orbicularis of the eyelid consists of three parts: the orbital part, the largest, which originates from the middle third of the upper margin of the orbit and leads all around the orbit to insert on the middle third of the lower margin of the orbit. The tendinous aponeurosis, which separates the origin from the insertion, and is called the medial palpebral ligament. The palpebral part, on the other hand, which consists of the two laminae that make up most of the eyelids. These originate from the medial palpebral ligament and go to insert on the lateral palpebral aponeurosis. There is also a third portion of the orbicularis muscle of the eyelids. This third portion, called lacrimal, originates from the ridges of the lacrimal bone. Its function is to squeeze the lacrimal gland. The corrugator muscle of the eyebrow, on the other hand, is much simpler. It originates from the medial extremity of the eyebrow arch and inserts itself in the subcutis of the eyebrow region. The orbicularis of the eyelid, with its action, closes the eyelid rima. The brow corrugator, on the other hand, as the name implies, wrinkles the eyebrow. Let's now turn to the nasal muscles. There are two muscles to consider. First of all, the procer muscle, which originates above the frontal muscle and is inserted on the suture between the two nasal bones. Then there is the nasal muscle proper, which is formed by two parts, the transverse muscle of the nose and then the myrtiform muscle or wing part of the nasal muscle. Both have the same origin. They originate at the level of the canine, from the maxillary bone, and lead upward. After that, the transverse of the nose goes to cover the large cartilaginous wings, forming an aponeurosis on the sagittal line that will join the aponeurosis of the contralateral nasal muscle. On the other hand, the myrtiform muscle joins one end of the quadratus of the upper lip and inserts on the frontal process of the maxillary bone. The part of the face where the greatest amount and complexity of muscles is concentrated is precisely the lips. This is because the human being, having developed a complex paralanguage, has developed in parallel a different capacity of expression. a certain ability to diversify facial expressions in order to always express different concepts. The first muscle we are going to talk about is the square of the upper lip. The square of the upper lip is formed by three different heads. We have a medial head, a central head, and a lateral head. The lateral head will insert on the frontal face of the zygomatic bone. The medial head will insert below the orbital opening, while the medial head, joining with the myristic muscle, will insert on the frontal process of the maxilla. Inferiorly, the three heads will converge and insert on the lateral third of the labial rima. With their action, these muscles will lift and bring out the labial rima. Then, there is a zygomatic muscle, which originates at the level of the corner of the zygomatic bone and goes down, going to insert itself on the commissure of the labial rima. This muscle, with its action, brings up and back the corner of the mouth. Then we have the so-called vaccinator muscle, which is a complex fleshy lamina with a rather wide insertion. It originates from the pterygoid processes of the sphenoid, from the external face of the alveolar process of the maxillary and mandibular, from the maxillary tuberosity, and from the aponeurosis of the region, to insert itself with a single muscular belly on the whole lateral part of the upper and lower labial rima. The vaccinator, with its action, moves back the labial rima, making the gums adhere to the cheeks and allowing some movements that will be involved in chewing. Therefore, its classification as only a mimic muscle is rather reductive. Then we have the risorius muscle, which has a triangular shape and is one of those muscles that has nothing to do with bone, as both its origin and its insertion are not bony heads. It originates at the corner of the labial rima and inserts at the level of the parotid fascia. By its action, it brings the corner of the mouth back and down. Among the muscles of the inferior labial rima, we find the triangular muscle, which originates from the anterior third of the lateral part of the body of the mandible, to be inserted in a unique way on the corner of the mouth. With its action, it brings down the corner of the mouth and curves the lip. Another muscle with an origin almost overlapping that of the triangular muscle is the square of the lower lip, although it is placed deeper than the triangular. However, the latter is carried a little more towards the mandibular symphysis, reaching the most central and medial part of the lower lip. Its action brings the lower lip down and rotates it outward. Another muscle in this area is the mental muscle, which originates from the mandibular symphysis and is carried on the lower part of the orbicularis of the mouth. Its action is not so much about changing the expression of the mouth as it is more about wrinkling the skin of the chin. The last muscle that has to do with labial rima is the orbicularis of the mouth, a large muscle that enters the constitution of the lips. The outer part of this muscle is made up of bundles from all other muscles of the lips, while the inner part forms quadrilateral laminae that will form the scaffolding of the lips. With its action, it tends to close the buccal rima and bring the lips forward. Now, let's focus on the analysis of the masticatory muscles. The masticatory muscles have a more basic function, as their utility is precisely to promote nutrition through mastication. There are four muscles. The first is the temporalis muscle, a muscle that occupies the entire temporal fossa, originating from the superior temporal line and closing in a triangle, with all its bundles and going to insert on the coronoid process of the branch of the mandible. this muscle with its action lifts and brings back the mandible, thus allowing chewing. The masseter muscle, on the other hand, is composed of two portions: a superficial portion, which originates from the two anterior thirds of the zygomatic bone, to bring on the external face of the posterior part of the body of the mandible. The portion which originates from the two posterior thirds of the zygomatic bone and the zygomatic process of the temporalis, and, running posteriorly and deeper than the superficial portion, goes to insert on the external face of the angle of the mandible. With its action, it lifts the mandible. Of somewhat more complex understanding are the pterygoid muscles. These are two muscles that are internal to the surface of the face. We have a medial pterygoid muscle and a lateral pterygoid muscle. The lateral pterygoid muscle originates with two heads and has a single insertion. The upper head originates from the external face of the great wing of the sphenoid, while the lower head originates from the external face of the quadrangular pterygoid lamina. The two heads decorate to go to join at the level of the condyle of the mandible in the joint capsule of the temporomandibular joint. You can easily see how this muscle doesn't play a huge role in lifting the jaw. In fact, it even lowers it slightly. Its function in contraction is to move the jaw in the other direction, thus allowing movement in the lateral plane. The medial pterygoid muscle, on the other hand, originates from the medial pterygoid process, the pyramidal process of the palatine and the pterygoid fossa, and, as a vast quadrilateral lamina, goes to insert on the inner face of the angle of the mandible. By its action, it lifts the mandible and moves it to the opposite direction.
This video was created thanks to Anatomy Learning, an interesting free web app. The hyperlink can be found in the description. Instead, the text used for the concepts is Human Anatomy of Eddie Hermes. Thanks for watching.